All right, Eric, thank you very much for that report. Joining us now is Tony Holland, founder of Global Premier Benefits, an organization that helps people navigate the world of health insurance, which we all know can be complicated at times. Tony, thank you for being here. I want to start just with the basics right away. For folks out there who don't know specifically what Medicaid is, it's not Medicare, we know, it's not Obamacare. Define it, please, in simple terms, Medicaid.
Simply put, Medicaid is a partnership between the states and the federal government to provide affordable health care for those that need it the most, the lowest income individuals in our society.
How many, sir, do you know are on Medicaid right now across the U.S.?
There's millions, and this is potentially going to affect about 8 million recipients.
Okay, so we got the basics out of the way. As lawmakers on Capitol Hill, and we saw in that report, they're supporting the president's bill, trying to get it across the goal line, the finish line. There's also the issue of Medicaid, and Republicans say, as we've seen, they're trying to root out waste and fraud and abuse. Democrats say millions of Americans will be hurt and lose coverage. Where does it all stand in your opinion?
In my opinion, first of all, it's 880 billion in potential cuts over a 10-year period. And I truly believe when Congress gets together and they meet, some things are going to make sense to move forward on, some things won't. I think there should be additional requirements, especially for eligibility in terms of the working for at least 80 hours a month, or volunteering, or attending school. I think that should be part of the package. Those that are able-bodied should not receive benefits. Those benefits should go to those that need the benefits the most.
Do you believe there's a lot of abuse right now? And are you able to
there's a lot of
quantify
abuse.
it? Okay.
Yes, it's going to prevent states from funding undocumented immigrants that are on Medicaid that shouldn't be. There's definite challenges with the provider tax changes that will affect the funding, those that have taken advantage of the system. And even going back to the Biden administration, that was addressed, that was a serious challenge that needed to be resolved. But I want to make sure your audience knows that this is not going to affect pregnant women. About 50% of newborns are covered under the Medicaid system. That's a lot. It's not going to affect the elderly or those that legally qualify. It's not going to affect those that are disabled children, those that are medically exempt that rely on Medicaid are going to be just fine. So I think the whole goal is to make Medicare more efficient. I think government as a whole needs to be more efficient by reducing waste, fraud, and abuse, sir.
What if there are no cuts to Medicaid? Just let it go as is.
I think there's going to be a huge challenge because it can't sustain itself if we have undocumented immigrants that are on the system with all the fraud, the waste, and abuse. It's not going to be able to sustain itself. And ultimately, those that need the benefits the most are going to suffer.
And if I'm a mom or a dad, single parent perhaps, have a few kids at home, relying on Medicaid to take my child to the doctor for that earache, I'm worried right now, seeing the headlines. I'm fearful that I'm going to lose this, and it's going to hurt my family. Even the fear sometimes is enough to make people not want to pursue it or the coverage of it. What do you say to those folks?
I believe they're going to be just fine. Those that have the medical exemptions, those that legally qualified, if their kids are having challenges medically, that are disabled, they're going to be just fine. It's those that are abusing the Medicaid system that won't be fine.
Tony Holland, we're going to have to leave it there, and we'll see how it all plays out on Capitol Hill. Thanks for your time.
It was an honor. God bless.
Okay,
Thank you.
Take care.